two types of insulin we're going to talk about today. So we've got your background insulin, or sometimes you know it as your basal insulin, and we've also got an insulin that's rapid acting. So what's the difference between the two and what should you be using? Hi, my name's Diana and I'm your consultant pharmacist, diabetes educator and dietitian. So let's talk about this little guy first. So there's a few different type of brands, but here I've just got one particular brand just for show and tell purposes. This is what we call our basal insulin or our background insulin, and the whole design of this pen is to give you a very slow trickle of insulin doses to cover your background needs to keep your baseline blood sugar levels at a target area, which is usually discussed by your diabetes team. Now, it's a clear insulin here in Australia. Most of them are clear, usually just given once a day. In some cases, we do see it twice a day, depending on the person's needs and prescription of the prescriber. So generally, it's a clear little insulin. You get a certain amount of dose, and then every week you get it titrated or adjusted according to your blood sugar levels. Most likely the time, in order for us to know that this is working for you, the blood sugar that we usually measure is first thing in the morning, and sometimes your pre-meal readings, just to see what your background looks like. The other insulin we want to talk about is what we call the rapid insulin. Some people call it prandial insulin, some people call it food insulin, lots of different names. The whole design of this compared to the other one, which is long acting, this is more so a shorter acting one. So the whole design of this insulin is to cover your food. So background insulin, this one's a little helper in terms of your blood sugar increase after meals. So you'll get a certain dose to cover your needs, and also a certain dose that may cover a certain amount of different types of meals or food that you do eat. And it has to be individualized. So this insulin, I would highly suggest if you are quite a variable person and you're using this insulin, despite having type 2 diabetes, you're still best to kind of get in touch with your diabetes care team. Now, usually when you have type 2 diabetes, quite often the basal insulin or the long-acting insulin is initiated first, and that can change depending on your HbA1c levels, your management, lots of different factors. Then what might happen is a rapid insulin is needed to be added, because we can see that your background basal levels seem okay, but then we know that there's certain peaks that happen with certain foods, meals, or that triggers your blood sugar to increase. That's with type 2 diabetes. Now in type 1 diabetes, which we know is an autoimmune, not necessarily an insulin resistant condition, you more than likely need both. In usual circumstances, you'll need a basal insulin and you'll need a rapid insulin to cover your foods. Now, if you are on a pump, you wouldn't be using the basal insulin, because you simply will be using the rapid insulin, because your pump and technology is able to cover your after food blood sugar insulin needs versus your background insulin needs. So there you have it, a speed summary of insulin. What type of insulin do you use?